Okay, so I can't tell. I'm gonna presume people are in with us now, Angela.
Yep, they're
Okay.
joining.
This is a different format than what I'm used to seeing. So hi everyone, I'm Carrie Lelgedal. Thank you for coming today. Um, I am a mom, I am a family advocate, and I am really upset with what's going on in the world of how it's going to affect all of us, our loved ones, and what we could possibly do to fix it, which is why we're here today to hopefully explain to people what's at risk and how we could go ahead and come up with ways to have our voices heard. I'm going to let the other three panelists introduce themselves, and then I'll tell you a little bit about myself and my son. Go ahead, Ann.
Okay, well, good afternoon, everybody out there, and thanks so much for joining us. We know you're pretty overwhelmed. In some ways, we feel overwhelmed by everything that's going on with this administration, with this Congress, and with the programs we know and love and the people we know and love. But we also are very determined, and we hope that by the time we finish up here, you will feel equally determined and help us out because you are all rock stars in terms of helping to push back what we know isn't good. So I'm going to give a quick high-level overview, and I'm Ann Montgomery. I'm currently with the National Committee to Preserve Social Security and Medicare, and I have the enormous pleasure of working with Carrie Lelgedal that you just heard from Carrie briefly, and she'll be back. Nicole Jorwic, Lindsay Heckler, and others. Lots of people are out there, highlighting what is not good about the various maneuvers really to kind of take down programs, take down federal government staff, and so on. So when it comes to older adults, I really do think of this as an assault on older Americans. I think it puts older Americans at risk, despite claims of not touching Medicare, which is arguable, and maybe Nicole will get into some of that. There are so many steep cuts being proposed all at once that I think unless we succeed in pushing some of them back, we're going to see a rise in hunger among older adults, homelessness, and of course, a lack of health care due to the Medicaid cuts. So I think I'll start with the SNAP program, which is the food stamps program. And I don't know if you all follow SNAP as closely as you follow healthcare. And I must say, I was pretty shocked when I first started to look at this. The reductions in SNAP that are proposed in the House Reconciliation Bill, which, by the way, only passed by one vote and is pending in the Senate. So that's one reason we wanted to talk to you all, because we have a chance to change things in the Senate. But right now, those cuts are at 30% of total program funding, or $300 billion over 10 years. And there are work requirements, or rather penalties, for people if they aren't working the required amount per week and prove that to some state official. And those work requirements now apply to older adults, age 55 to 64. That's never been true before. And it's going to result in a lot of older adults who already face age discrimination, who already have difficulty holding down jobs, particularly if they're hard, manual labor or just hard physical jobs. They have a hard time holding those jobs up until 65. So it will result in many older adults being dropped from food stamps, or their family being dropped from the SNAP program and facing hunger. And that's pretty shocking. The next thing, and I know Nicole and others, Lindsay will expand greatly on this, but the Medicaid reductions are phenomenal. They're terrible. Medicaid is our largest healthcare program in the country. It also is an economic engine for states and a workforce program. And the cuts envisioned and passed the House are in the range of $700 billion through 2034. And the results of this are predictable and foreordained, and we want to stop them. We're going to see job losses if they go through. We're going to see at least 1 million jobs, according to one study, lost in 2026 alone. And larger states, if you live in California, New York, Texas, Pennsylvania, Florida, those will be the most affected states. There'll be reduced economic activity because states will see a significant reduction in people working. They will see basically less money being paid to providers who form a big chunk of the healthcare sector in their states. Medicaid is 18% of national health expenditures. And there will be knock-on effects. For example, it'll negatively affect, Medicaid cuts will negatively affect state and local tax revenues. That's because of job losses, leading to lower tax collections. And keep in mind that the strain on state budgets will be really unworkable. They have to balance their budgets in most cases. That's a constitutional requirement for most states. So they will not be able to kind of run up a deficit as the federal government can. And they will have to reduce services, reduce jobs, and basically hurt their own economies. And in turn, this will affect our healthcare system in a very, very negative way. Hospitals really can't, work without the largest healthcare program reimbursing many of the people who seek their services. Nursing homes can't, doctors can't. And there will be a massive drop if these cuts go through in healthcare spending in states, and it will mean a lot of closures of many healthcare providers, clinics, hospitals, nursing homes, and so on. And people will begin to realize really what the role of Medicaid is. It's irreplaceable. And there is no replacement in this reconciliation package for Medicaid. There's not even a pretense of trying to come up with other programs or solutions. So all told, we have estimates that 14 or so million Americans will lose their health insurance coverage. And many of them will also really struggle with the expenses if they're not able to enroll in Medicaid or able to enroll on the state exchanges that are set up by the Affordable Care Act. They won't be able to afford healthcare services either. And so their medical debt will probably explode. So none of this is good, and we need to pay a lot of attention to it and focus on people who have already indicated that they're worried about this. One senator who's already indicated he's worried about this is Josh Hawley of Missouri. He's not a liberal guy, he's a very conservative guy, but he wrote an op-ed in the New York Times, I think on May 12th, which was very good, and noted that in Missouri, which is similar to other states, basically half of the people that he surveyed or that have been surveyed say, yes, they're either in Medicaid or they have a family member or friend who is in Medicaid. So it's a massive impact, and he well understands that. So the Great Panthers, New York City, I'm proud to be very closely associated with them through Carrie and others, is very concerned about this with regard to the nursing home impact. We have a petition out there, and Carrie will probably drop it in the chat. It's so bad in terms of the impact it would have on nursing homes that the Great Panthers, New York City calls it the dirty diaper bill, meaning people would not be tended as they need to be, because the first reduction in nursing homes to save money when there's not enough of it is in staffing. Staffing is already very low, and it would get a whole lot worse. So that's a major, major concern. Nicole may also talk about the fact that although nursing homes are, quote, a mandatory or required benefit under Medicaid, all those people who get services at home, those are optional services, and they could really completely wither as states tried to figure out where to cut back. They would cut back on the optional services first because they're basically legally required to do that. There's a lot of bad news in the housing programs that aging advocacy organizations and disability rights advocates care about. So, for example, the Housing and Urban Development Section 202 program for older adults and the Section 811 program that have been counted on forever are zeroed out in the forthcoming fiscal year 2026 administration's budget. And the Department of Housing and Urban Development itself is being partially dismantled like other agencies. So one wonders whether there'll be enough staff to run the programs. Big concern. Big concern also over at the Social Security Administration. Offices are being reduced in terms of staff, closed. That's definitely true of the budget that's been proposed for the Department of Health and Human Services that would plunge by about 30% if that happens. And regional offices are already being closed. Programs are being consolidated, and it's not at all clear that programs will survive or that they will be well staffed if they are moved around. There's a lot of pushback, and we're counting on that. We're counting on you all to help us push back. So, for example, there are many lawsuits, and I was reading today about HHS staffers who've been laid off with no explanation, with good records and so on. They're suing. That's a good thing. We'll see if many of those lawsuits can prevail. Shout out to Public Citizen, to my own organization, the National Committee, and many others that are really pushing back in the courts. And in some cases, there is pretty good success. This is a long, ongoing battle that we will have to wage together, and some of us will be able to wage it on different fronts, I think. The dual eligibles, low income Medicare beneficiaries, are at risk as well, because if they have a hard time signing up for Medicaid, which they may, because the requirements to sign up for Medicaid and to retain Medicaid are going to become very, very difficult if the reconciliation bill goes through, then those folks will be at risk of not being able to access Medicare, which is, of course, is an entitlement. And that is because Medicaid pays their copays, their deductibles, their premiums, and their prescription drug costs in Medicare. So if they can't sign up for Medicaid or have a tough time retaining it, they're going to be particularly at risk of losing a lot of health care. So, are there any bright spots? Well, yes. The low income housing tax credit program is still with us. There's a tax preference program in the tax portion of the reconciliation package known as opportunity zones, which are, I think, good for investors. They give them a tax break, a capital gains tax break, if they develop either residential or commercial buildings in low income disinvested areas. So those are still there. So that's good. And not all is doom and gloom, but a lot of it is. And overall, the future for older adults and people with disabilities looks dim right now. And the last 50 years of effort and achievement are definitely at risk. But we know with the people on this call and many, many others that we will have some success. I hope a lot of success in pushing back. So now I will turn over to my amazing colleagues. I don't know if it's Carrie, Nicole, or Lindsay. You're up. Thanks so much.
Sure. Thanks so much, Anne. I can hop in and I'll do a quick intro, and then Lindsay, when you hop in, you can do your intro and we'll go from there. Thanks so much, Carrie and Anne, and I'm glad to be with you all today. My name is Nicole Jorwic. I'm the Chief Program Officer for Caring Across Generations. And Anne just did a fantastic job of laying out the wide variety and wide breadth of the threats that are out there for older adults in the budget bill that's actively being negotiated. And one of the things that we're really focused on at Caring Across Generations, along with many, many other partners, is really around around Medicaid defense. So I'm going to talk about Medicaid defense, where we are with all of that. And actually, as Anne was talking, we have new hot off the presses numbers that show that the Medicaid cuts being proposed will actually lead to 16 million people losing their coverage. So the news is always changing, and unfortunately, it always looks like it's getting a little bit worse. As I said, I'm the Chief Program Officer for Caring Across Generations. I'm also a co-chair of the Disability and Aging Collaborative at the national level that includes a lot of groups, including Anne's organization and those of us that are really focused specifically on Medicaid and access to home and community-based services, but also Medicare, Meals on Wheels, a lot of other services. I also am a family caregiver. My brother Chris is 35 and has autism, and I'm also on the care team for three of my grandparents who are still around and in their 90s and have a wide variety of care needs themselves. So this is an issue that I work on personally and that I work on professionally and that I deal with personally. And one of the biggest things that's really important right now is to understand Medicaid and why it's under threat and why we need to all come together to protect it along with Medicare. So we can go to the next slide, Angela. So Medicaid is, a lot of people think of Medicaid, and Medicaid is, of course, a healthcare program, but it is also so much more than a healthcare program. It is a healthcare program for a lot of family caregivers and a lot of care workers who need Medicaid for their own health insurance coverage, but it's also a workforce program. It pays the wages of over 70% of direct care workers. It is also the country's main funding source for long-term care. Not Medicare. Outside of Medicare only covers a very narrow home health benefit or acute care coverage at home. It is also, as Anne mentioned, why it's particularly important is because it's the largest source of federal funding to states. It makes up 1/3 of state budgets, and that means that even with the cuts being proposed, that it will impact other areas of state spending. It covers the actual amount of care, and as of right now, there's no maximum amount that people or states can spend. You can go to the next slide. It is a lifeline really for older adults and disabled people, especially those who rely on home and community-based services. Medicare, as I said, and private insurance largely do not cover long-term care, and Medicaid fills the gap, again, accounting for 61% of all long-term care spending in this country, nearly 70% of home care spending. So that just shows how much this program is really the backbone for the long-term care system in this country. And again, it is the primary source of funding for direct care workforce wages, which have been historically low, and we need to address that as well. You can go to the next slide. Um, Medicaid is very complicated. That's part of why we're always out here doing these webinars and having some of these conversations. And part of why it is complicated is because it is a state and federal partnership. Any state knows that if they're going to invest $1 into Medicaid program, that they are going to get reimbursed at an already agreed upon rate from the federal government. And so that means that both state and federal dollars are going in, but it means that states are running the program. How that shows up, it's called different things in different states. In California, it's Medi-Cal. In Tennessee, it's TennCare. So it's really important to have an understanding not only of all the different types of services that Medicaid provides, but also what it's called, because that's also really important when we're in the defense conversation. Medicaid is a partnership run by the states, but what oversees it and what sets some standards, sets a floor for different things, and also what decides what is mandatory and optional is a federal law. And the federal law makes some services mandatory, but when home and community-based services were created by Congress under President Ronald Reagan, they were created as optional services, despite the fact that, of course, they're not optional to the people who need them. And what that means is that when you see massive cuts, that optional services, those are the first place that states are going to cut. Not because they want to, not because it's the smartest strategic decision, but because because that is the place that they can cut, because they have to continue providing mandatory services like traditional healthcare services, prescription drugs, facility-based care. And so that's why we're particularly worried that home and community-based services will be particularly impacted by the current cuts that are being proposed in Congress. And how optional services show up now is waiting lists. States can cap how many people they're serving, how many different types of folks with different eligibility categories are serving, that sort of thing. Next slide. So where we are is Medicaid is being looked at and being used as a piggy bank. Right now, there's a budget bill that is moving through Congress, and we'll talk a little bit more about where it is, that has up to, and really this should be closer to 800 billion, with 16 million losing coverage. Thank you to Angela, who must have updated that slide on the fly. Major cuts to Medicaid are the only way to meet required spending reductions. But again, we need to make them so toxic and slow them down because they are such a real threat. We can go to the next slide. So what's at stake? When we're talking about Medicaid, that is coverage for 80 million individuals. It includes 11 million people with disabilities, 7.2 million older adults, and nearly half of all children with special health needs. So that could be disabilities or chronic illness. 40% of new parents, 50% of births. So many things are covered by Medicaid, and all of those services are at risk. And home and community-based services for 7.8 million seniors and disabled people are also at risk as we because of the what we're facing right now. Uh, we can go to the next slide. Oh no, sorry. Go back to that slide. Um, Thank you. And then I'll turn it over to Lindsay in 1 second to talk about Medicare. Just want to name that we have slowed them down and mention the fact that we do have members from both parties speaking out very loudly about their concerns around these cuts, and that should make us feel good. But the unfortunate reality is these cuts did pass one house of Congress already. And so now we're going to be pushing very hard to make sure that it doesn't get any further, because there are these massive cuts to Medicaid. And again, because we need to see further modernization of these programs, and it's going to be even harder to do that if we allow these massive cuts to go through to either Medicaid or Medicare. And I'm going to pass it over to Lindsay because I will start out by saying that the current bill does include $500 billion in cuts to Medicare as well, and generally cuts to Medicaid are cuts to Medicare. But Lindsay will go more into all of that, and I'll pass it over to you.
Thank you, Nicole. So my name is Lindsay Heckler. I am the managing attorney in charge of policy with the Center for Elder Law and Justice. We are a legal services organization based in New York State, and we are out of the Western New York region of New York. So as Nicole said, and as Anne eloquently explained, a cut to Medicaid is a cut to Medicare. Currently, as the proposal sits, if it were to go through, it would implement what's called statutory pay-as-you-go rules, which means there would be an automatic 4% cut for the Medicare program, which equals $500 billion. And that's just 4% across the board for Medicare. However, direct cuts to Medicaid is a direct cut to Medicare. So for example, as Anne was saying, Medicaid makes Medicare affordable. So for example, Medicaid provides Medicare premium assistance. So 1 of 6 Medicare enrollees have their Medicare premiums covered by Medicaid. Medicaid also covers out-of-pocket costs, so coinsurance, copays, deductibles. Medicaid also helps cover through the Extra Help program, for example, the expenses of prescription drug expenses through Medicare Part D. Importantly, Medicaid enables Medicare enrollees to age in place. So as Nicole was saying, Medicaid is the primary payer of home-based care, but it is not required under federal law. So if these cuts go through, what's the easiest thing to chop at the state level, unfortunately? Access to home and community-based services. And as a result of this, we're going to see more older adults and persons with disabilities forced into institutionalized settings, which is directly in violation of the Olmstead requirements and extremely concerning. Also, as Nicole said, Medicaid covers services not covered by Medicare. So vision, dental, hearing services, medical transportation, all of these services that many older adults rely on to be able to age with independence and dignity and access health care, for example. Medicaid, quite frankly, does strengthen Medicare for all enrollees, not just individuals who are dual eligible, so Medicare, Medicaid. So Medicaid increases access, as Anne was saying, it gives people jobs, it helps people stay employed. So altogether, if these Medicaid cuts go through, we're going to see a spiraling effect that impacts every generation in our country, not just older adults. So bottom line, a cut to Medicaid is a direct cut to Medicare and really a direct attack on all of our constitutional rights to age with independence, dignity, and in the community. So with that, I'm going to turn it back over to whoever is next. I think, Carrie, are you next?
So I'm really glad everybody's did such a good job of explaining to you what the programs are and how they work. I'm going to tell you how the nuts and bolts really work because I've lived every drop of it. I have a 37-year-old son who was born with a very rare seizure disorder, and he has developmental disabilities. So just to give you a real quick rundown there, he has like 14 doctors because he also has diabetes, all kinds of vision issues, you name it, he has it. And home and community-based services are truly what's better for everyone when they can be done and done right. And we had my son home for a lot of years. My husband and I had some fabulous caregivers that we trained, and we had a system for everybody until he broke his leg on a Saturday, and then I had a heart attack on Tuesday. And all of a sudden, the state of Illinois is like, my husband and my twin sister had asked them for a temporary increase in hours because it took 2 people then to move my son because of his broken leg. And I was in the hospital. And the state decided instead it was time to cut off my son's home and community-based services, and we would have to find a residential placement for him. So when they were explaining that home and community-based is voluntary, the type of placement my son needed is an intermediate care facility for adults with developmental disabilities and complex medical. That is an entitlement. By law, they're required to provide him that service. We were very lucky. We found a great home. He's still in that home today, but it's not him being at home. Give him his choice. He would live with me any day of the week, but we will never get this funding back to be able to do that. And I'm going to give you an example, and this is old numbers from when he was at home 13 years ago, but it puts it in place because the numbers still work the same. When he was at home, we got 200 hours a month that we got to decide what we did for care with him at $11 an hour. That broke out to be 6 hours and 6.6 hours a day. And it worked out to be approximately $74 a day, which equates to $2,200 a month. The home my son lived in was paid by the state approximately $250 a day, or what equals out to be $7,500 a day. This was in 2013. Today, they are paid almost $200,000 a year to care for my son. Now, he is in a home that has 95% of the people have some of the highest medical needs for adults with developmental disabilities in the state of Illinois. But a good number of them with a good placement could be in a home and community based. Like I said, we did it for years for my son. I've, helped other people do it, whether it's for somebody that's elderly or somebody that, has had a stroke at 30 years old. Nobody wants to go live in a facility of any type, no matter if you find the best one or the worst one. And I learned during the pandemic, there's a lot of worst ones, way more than we know. And that taught me that it was time to do something. Somebody very early on, my friend Jack that's on here probably is one of them, decided to name me the one mad mom. And I was furious. I couldn't see my son for, 4 months. The rules were changing every minute. Everybody's rights were violated. And a whole bunch of us started working at what do we do? How do we raise our voice to fix this? And a whole lot of family members that knew nothing made a lot of differences in what we did. We've attempted to get a federal law changed or written to make sure family members always have some kind of essential access. We haven't had that yet, but we have a lot of state laws that states that did it. I did it in the state of Illinois, basically on my own with 2 legislators. We can do the same exact thing today with our senators to get these cuts to Medicaid stopped. If they hear from people, they hear our stories, whether it's by email or calling their office and driving their aides nuts or in person. And let me tell you, the best thing of all is go to DC and kind of sneak up on them when they're like supposed to be somewhere and you corner them. I've done it multiple times. They need to hear our voices. We are not in a position where we can wait for whether it is Great Panthers, which is I am on the board of, or whether it is Caring Across Generations, who does incredible work, and I'm one of their fellows. But again, we can't wait for these organizations to do all the weightlifting. We need every person to do something to make sure our legislators know it, including going to the route of getting hold of the Republican legislators, even if they're not in your state, even if you're not in their district, and say, hey, I know I don't live in your district, but I'm still a constituent in the United States. You are representing me, and we need to fix this. Nicole, I'm gonna let you go next, and then we can kind of go around whatever next.
I think Nicole got a call.
Okay.
So we can go to Q&A, everybody. If you would like to put any questions in the chat or raise your hands, if there's the ability to do that, we'd be happy to recognize you. And as you can hear, Carrie is a formidable advocate. She has shown, as other people have, she's just a particularly good example of how a regular person can become an amazing asset, to the cause of improving and then stopping the harm that we're now seeing. And it does take more than a village. It takes about 1 million villages to stop this one. This is a bad one. And it is a flood the zone strategy that many are using in the administration. Every time you turn around, there's something else that's zeroed out, like the Community Services Block Grant, which provides states with many, many dollars, 800 million, to do all kinds of things, including building housing. The Low-Income Housing Assistance Program, Heating Assistance Program, zeroed out. The AmeriCorps program, which basically deploys volunteers, including seniors, to help communities in whatever they need, zeroed out. So there's a lot going on. There may be a favorite, cause that you have, and we would like to help you, and we hope you'll help us.
And
Anybody have any questions?
I'm going to add something that I just realized not one of us have said. The number of veterans that are on Medicaid is huge. I believe it's about 40%. And it might even be a little higher because their veteran services doesn't cover everything they need. And especially if you're talking about a disabled veteran and who's come home and he's given to us, why are we not taking care of him or her? And we should be. And there should never be a question, especially for somebody that's served, to take care of this country, why we aren't providing the services they need. And, and the VA homes and the VA programs have as much funding at risk as the rest of us.
Mm-hmm.
So someone asked, what's the time frame before the Senate takes up the budget reconciliation?
I'll take a shot at that. Lindsay, you may have information. I think probably Nicole would have the best information. My understanding is that the president is telling Republican senators as well as Republican House members, but the House has already passed this really terrible, dirty diaper bill. But he's telling Republican senators he wants to sign the bill on July 4th into law. So that means sometime in June, the Senate would begin to vote on this. There are lots of rumors afoot, and as we've all said, things do change rather rapidly. But it may be that the individual committees in the Senate don't actually hold legislative markups, or looking at the programs under their jurisdiction, like Medicare and Medicaid, are in the jurisdiction of the Finance Committee. Maybe there won't be a Finance Committee markup, and it'll just be bundled, for floor consideration. So I don't think that it's exactly known as to precisely what day, but it's coming soon. So if you can sign that petition that's in the chat, if you can find others to sign, if you can flood the phones, send emails and so on, which have to be counted and which do therefore really matter in the final disposition of policy, then please do, because we don't have a lot of time.
Lindsay?
Yeah, I echo everything Ann said, and it's extremely concerning that this process is happening in closed door conversations right now at the Senate level. That's extremely concerning. But I want to just really emphasize the importance of calling and sharing your personal experience, your voice. Otherwise, what people are looking at are numbers, data. That doesn't necessarily equate to real life human experiences. So please, please, please contact the senators, share your story and why this is it's important that the cuts don't go forward.
I've had a few people ask now. We will share the slides, we'll share the recordings. I'm not sure how quick either Great Panthers of New York or Carrying Across or both of us can get them on our websites. But I will, as soon as I can access these from Carrying Across, I will work with our tech person from Great Panthers to see how quick she can get it all up. The slides obviously will be much quicker than the recordings. And it's like, we've all said too, reach out to us. If you don't know what to say or who to say it to, just ask. But, they have to listen to whatever it is. And, you know, legislators feel like a royal ass when they hear a story like mine and they have to watch me say it to them publicly with an audience standing there. And I've done it. I'm sure Nicole's done it with stuff with her brother. The last thing they want is us to make them look like the fools they are being. And if you could get the opportunity, honestly, to throw them under the bus, go for it. And Ann will tell you, I take pride in that one.
She is fierce. I want to give a shout out to Caring Cross Generations and the National Domestic Workers Alliance for doing a Medicaid vigil recently on the U.S. Mall, which looked right at the Capitol. And the stories that were told there, and we should do this again, not necessarily right there, but all over the country. Let's have Medicaid vigils, and people with disabilities and older adults in some cases and advocates showed up and said, look, this is what it means to me personally, or to my daughter, son, spouse, grandmother, whatever. And you're not fooling us. We know you're lying to us that it wouldn't affect us. It would affect us dramatically, and it could well be life-ending. So we need more of that. If any of you are up for doing that, for organizing something in your own state or your own community, do it, film it, send it to us, send it in, send it to your representatives. We do need them to understand that this is not about, waste, fraud, and abuse. That's the biggest, phoniest lie I've ever heard in my life. It's about cutting people off of healthcare and not replacing that and letting things devolve into chaos. Because why? Because we want to give people who don't need more money some money. It really doesn't make any sense. It's a direct attack on not only the government and our way of life, but, democracy. So we're stepping up, and thank you for helping us step up.
And on that note, I want to just mention that great thinking and great minds think alike, and thanks for the kind words about the vigil, because there will be more to come. So stay tuned and definitely follow Caring Across Generations, because there will be more opportunities with all of our partners. It will be an unbranded. This year in July is the 60th anniversary of Medicaid and Medicare. So look out for the week before that, a longer than 24-hour vigil, likely like 60-hour vigil to honor those 60 years at the National Mall, but with a lot more, with including like what Ann talked about, distributed action, so that we can make sure that this is going on in every community, because every community is going to be impacted. And also we'll also have opportunities for dinners and other things leading up to it to make sure that we are showing all of the different ways that these cuts will harm all the different constituencies. And like I said, every community, from rural health centers to senior centers and all of the places that are really at risk.
So I'm going to add something that we don't talk enough about it in this setting, which is the kids that are going to be treated and that are going to lose their services. I don't know how many of you have ever stepped foot in a children's hospital. I can tell you I pretty much lived in one when my son was younger. And I would say, especially in big city, children's hospitals, and kids are flown in from all over the world, especially all over the country, to be treated in these hospitals. Most of them are Medicaid. And the hospitals don't always chase people for money because they are there to provide services and care for them. You know, the pregnant mom who, has preeclampsia, and now she's delivering two-pound babies. Those babies are entitled Social Security as soon as they're born because of their size, and they're entitled to Medicaid. They're not going to get these funds. The part of this big dirty diaper bill, it really does affect everyone, because in some setting, whether we want to talk about it or not, there is somebody wearing a diaper that somebody's not going to have time to change quick enough.
Thank you.
There's some questions about where you can circulate the petition anywhere, LinkedIn, wherever you can. So just put it out there on your listserv if you have one, or your favorite family members and friends on Facebook. Yes, so anywhere you are, if you get it out there, then that would be wonderful.
It looks like we have someone that has their hand up. Jan, did we already get to that question?
No, go ahead. I don't know how you unmute her. How do we do that? Let's see. I see Jax. I don't see Jan.
At
There you
our
go, Jan.
national meetings in Washington, that if we went to the offices of members of Congress, they were never there. And a lot of times we ended up talking with underlings who would do nothing. And I think an example of a better way to proceed is in today's The American tab, The American Prospect, which if you don't read it, I recommend it. They have an amazing article about what people in Iowa are doing about Joni Ernst. When a senator can get away with telling you that, well, you're going to die anyway, that's really bad news. And Iowans are gearing up. And even Tom Harkin is getting involved. I was so happy to hear that. The much honored author of the bill that does more than anybody to protect disabled Americans. What they're doing in Iowa is taking Joni's stupid statement and putting it all over the state. They're putting it on billboards, and she is really running scared now that she's not going to get reelected next year. That puts the fear of the voters into someone who is otherwise so completely uncaring, which is shocking. She's a veteran. You'd think she'd act a little more respectful. So I think there are a lot of strategies that we can recommend to our colleagues. Some of them, have to be really strong. And petitions, I don't know. I haven't seen a petition do much, but when you get the voters out in large groups and you shame these people, they start to wonder, oh, maybe I shouldn't have said that, or I shouldn't have voted that way. They don't really care, of course, about all the people that they're dispossessing. I think there are some other things that we need to do. We need to teach people to follow the money. This isn't just about cutting taxes for the rich. This is also about raising the profits for the insurance companies. And if you look at the money flow, as we did in our last Panthers gray paper on the nursing home industry, we revealed that there is an enormous interest group that simply wants to dispossess Americans from their rightfully earned health care so that they are forced to pay for private insurance. And of course, the whole scam of Medicare being exploited by the programs that have been proliferating crookedly is just an example of how that works. So if you I think we need to have an across the board varied strategy right now, because if we do just one thing, they'll ignore us. And I don't think we have time to be ignored. And lastly, my neighbor is the state administrator for Michigan's PACE program. And you can imagine she is freaking out. Where is she going to put people after they are dispossessed of their home care? And that's what she spent most of her adult life making possible. And I've been consulting with her about what she can do quietly so she doesn't get fired, and get this show out to where the families know what's really happening. And I think we can lend support to these administrators because they're really embattled. Thank you. Thank you for what you all are doing.
Well, thank you. I just want to say thank you for your energy and your passion and your ideas. They're very good. And you're right. We do need an across the board strategy. I think that's how you put it. And what each of us is able to do is invaluable, because we are all limited in our ability to take on everything. So we need to kind of fan out, and also to indicate that we're not giving up, you know. Even in the worst case scenario, if the Senate approves this bill, and I'm an optimist and think maybe they won't, but even if that happened, we will be out on the streets, and we will be telling them that this is not workable, that state economies can't handle this, that this is not a plan, that this is a deprivation of benefits of civil rights, and that we're not going to stand for it, and we're not going away. So I think we can get the message across, both this month and on an ongoing basis. Just going to take some muscle and some energy.
And just trust yourself. You know, a lot of people are scared to speak up. They might say the wrong thing or do the wrong thing. Just speak up. If you're speaking from the heart, the rest of it is irrelevant. And take every opportunity you're given to use your voice. Because you'd be surprised where those opportunities will present themselves. And we have to speak up. We have to talk even when our voices shake or makes us uncomfortable, because otherwise they win. And we can't let them win.
When I left the Medicaid vigil, I'll just say really quickly, on the National Mall a couple of months ago, I was wearing a T-shirt that I got there, and it said "Protect Medicaid," and I had to go up into the House of Representatives office building called the Rayburn Building and meet somebody there. And when I walked through the hall, I kind of forgot that I was wearing this T-shirt. I got a lot of comments, mostly positive, like "Go," yes. Some people were not happy. But I was just wearing a T-shirt, but it was making a statement. It was making, it was advocacy right there. So there are so many ways that we can be loud and effective.
Absolutely. And I think the most important thing is there's, I said, as we were on the Zoom, the numbers changed, right? And is so much numbers and data and other things that are constantly changing. It is important to try to know that. But honestly, the most important thing are those shows of support, like a t-shirt, like sharing your story, even if it doesn't have to be with your member of Congress. Of course, you should be sharing your stories with senators, but it also could be sharing. I'm currently that's why I'm not at my office. I'm with my husband's family on a trip at the beach, and I'm talking to all of them about Medicaid. It doesn't have to be and I'm not sharing data with them, right? I'm sharing how these services impact my brother's life, how my grandparents could use these services but just have a little bit too much money, and how I'd like to change that, but first we need, right? Those stories are really what connect us, which was the whole obviously intention behind the vigil. It will be a lot of that, because what we say at Caring Across Generations is that care is something that we all have in common. And you don't have to know the numbers. The only thing you have to be an expert on is your own story and why these cuts would be incredibly harmful to people that you care about.
As far as what senators, any Republican right now is better. We need to get their support. We have, with Ann's help, have identified some in certain states, we can post that on Gray Panthers website. I have all that information. And anybody on here that knows Irma Rappaport, if you need to know how to find a legislator, just ask Irma. She'll give it to you. She has it all. Do we have any other
Yep.
questions from anybody?
Yeah, use your 6 degrees of connection, and every single Republican senator is important. Some of them are maybe more sympathetic perhaps to not shredding the largest healthcare program in the country, but others are nervous. So certainly Josh Hawley's been very interesting to watch. Susan Collins of Maine, Lisa Murkowski of Alaska. Nicole, you probably have a few others. There are lots of people out there who know this is not the right thing to do. They're just being pressured to do it. It's like a loyalty test, as the media notes. But this is not about a loyalty test. This is about, programs that actually serve people who have no other alternatives. So that's what, those are the points that we're bringing forward.
Yeah, Senator Tillis from North Carolina, but obviously even if you have Democratic members, like I live in the state of Illinois, that is true for me and my family. You should still keep reaching out to them, and you can call other senators, but they're always going to ask where you live. But the most important thing is the more that the calls are happening, the more volume, the more we can slow things down.
Nicole, do you guys normally post on your website afterwards, webinars?
We don't usually post them, but I think we can share a recording.
Okay, that's fine. I can post it all if you guys just get that to me and record that in the slide. I have your slide deck, but either that both I can get them up on Gray Panthers website because we put them up. Okay, so then they just said that they'll share the slides to everybody that registered to at least get that going, which would be great. And if you're not sure, all else fails, just get on, reach out to any of the email addresses for Gray Panthers out of New York, and one of us will get back to you, usually me, and we'll get you directed somewhere.
Yes, and I know that I know Nicole and others will be posting about vigils and all kinds of other things where you can show up in person and take action. So stay tuned.
I think we're probably there, folks.
All right.
Thank you all so much for coming. And thank you to my friends for doing this with me. I really appreciate it.
Thank you, Carrie.
And
Thank you, Anne.
Thank you.
Yep, let's keep
Thank
fighting.
you, Lindsay, and thank you, Angela. Thank you, everybody.
Yep.
Have a good afternoon, everyone.
Bye-bye.
Bye.